Most people don't know this, but there is a disease called the silent thief of vision. And unfortunately, most people who have it do not know about it until it's a little bit too late. Glaucoma is a disease that affects the optic nerve, which is the cable that connects the eyeball to your brain. What happens is eye pressure can be high sometimes, and when that happens over a long period of time, it starts pushing against that cable in the back of the eye and eating it up. And so little by little, people start losing their side vision, their peripheral vision, so they don't really realize until it becomes tunnel vision. By then, the damage is permanent, and all we can do, if we can, is stop the progression and prevent these patients from losing that tunnel vision to go into completely blind. I'll never forget my first patient that I diagnosed with glaucoma as a first-year resident. The patient had come just to change his glasses, and when we do a confrontation test, we realized, oh, the visual field is not okay. Let's check it with a visual field test. And we realized that the patient had extensive damage from glaucoma. I'll never forget that shock on the patient's face whenever I told them that it was a chronic disease. We could only try to stop the damage and not gain back the sight that was already lost. This is why regular eye exam matters. It's super important. Even if everything feels okay to you guys, you have to go and see your ophthalmologist once a year and do a full eye exam, including the measurement of the intraocular pressure and everything else, honestly, with a dilated fundus exam and everything. Here's exactly what I tell my family members. I want you to go to see an ophthalmologist once a year. I want them to check your vision with and without glasses. I want them to measure your intraocular pressure, to examine your tear film, and to do a dilated exam to look at the back of your eye. And this is someone you love today, because honestly, everybody should be doing this.